question next. So I hope everybody is well. And to the public and to board members, please get your COVID booster and your flu shot and any other preventive vaccine that you engaged in. Appreciate it. I did get mine, and so raring to go. So I call the meeting to order for October, and as usual, we will dispense with our business and then hear from our speaker. The minutes of the September meeting were circulated to everyone. Are there any comments, corrections, edits, etc.? And if not, the chair will entertain a motion to approve the September meeting minutes.
So moved.
Second.
Is there a second? Thank you. Any opposition? And then the motion carries. Is there any other announcements to come before the group? Let me just say from the chair's perspective, it may be among the shortest on record for people, given everyone's schedule, and a couple couple of notes though before I introduce our speaker. Hang in there with me just a second. I think that's it. We'll hold everything else. I cannot see the group since I'm just on the phone. So please, as you know, I have a point of personal privilege this morning, and that I'm in the middle of renovation and have no computer connectivity. Anything to come before the board at this point? Okay. It's my distinct honor today to present our speaker, Rachael Hamilton, who is the Executive Director and Chief Executive Officer of Metro Louisville's Air Pollution Control Board. She will be addressing air quality in our city, a much talked about subject underscored by the recent South End Applegate Lane chemical explosion. Among other items she will cover, she will offer perspectives and education on the role of the district, its board, as well as its policies. As you know, and are familiar with after a few years, we always ask our speakers to address whether there are any public health related policy issues which would benefit from this board's advocacy or any new policies the board should consider. Ms. Hamilton, a longtime nationally recognized environmental scientist, received her law degree from the University of Louisville, has worked for several federal, state, and local level government environmental agencies in Florida, Indiana, and Kentucky, and for the last several years was in private practice at Frost Brown Todd, a Louisville-based law firm, immediately prior to her leading the work of the Air Pollution Control District. Over her years with the district, she has instituted best practice standards and reorganized the district's work with data-driven metrics and controls. The chair now yields the floor to Rachael Hamilton, who will offer 15 to 20 minutes of remarks, which will, in our usual format, be followed by questions and answers. and I understand that her PowerPoint is on the site for you all to follow through. So with that, the gavel is passed. Ms. Hamilton.
Thank you so much, Chair Margulies. That was a very lovely introduction, and I really shortened what I do here to having the privilege of leading 60 very dedicated environmental engineers, scientists, and professionals in the work of the district. So in order to get right to it, I'm going to share my screen, start my presentation. All right, can everyone see that?
Yes.
Very good. Thank you very much. So while today's conversation is going to focus primarily on hazardous materials incidents and the district's work in air monitoring, permitting, and compliance, I'm happy at the end to take any questions you may have about our work. So, as I said, I do have the privilege of working with 60 very dedicated environmental engineers, scientists, and professionals. The district has been here for nearly 80 years. In 1952, the General Assembly authorized KRS Chapter 77, under which any county in the Commonwealth could stand up an air pollution control district. Since 1952, we've been the first and only. As Chair Margulies mentioned, the Air Pollution Control Board is our regulatory and enforcement authority. Rather than Metro Council passing our rules are passed by our board. There is a suite of those rules that are incorporated into a federal state implementation plan and become federally enforceable by US EPA, as well as by the district. And most importantly, unlike our counterparts at the state, the district is able to be more stringent than state or federal law. And there's some really notable parts of our program where that shines. In particular, the Strategic Toxic Air Reduction Program, which was passed in 2005, after a West Louisville air toxics study found unacceptably high exposures to air toxics in our community. That program goes beyond the National Air Toxics Program led by US EPA. Another spot is our Risk Management Plan program, which we'll talk about in more detail here in a moment. While our board is our regulatory authority, Louisville Metro government provides us HR and fiscal administrative support. We are funded 10% through the general fund, about another 15% through Clean Air Act Sections 105 and 103 grant funding, and the remainder is funded through permit, program, and emissions fees. The district is delegated the Clean Air Act directly from US EPA. We're not delegated through the state like some local programs are. And with that comes the ability for us to develop our own plans to address national ambient air quality standards. Clean Air Act is a marvelous continuous improvement plan. It is health-based. Every 5 years, EPA is required to go back and review the most recent health-based standard looking at criteria pollutants, lead, sulfur dioxide, nitrogen oxide, ozone, particulate matter, and then strengthen the standards. When those standards are strengthened, the district is charged with developing the plan to maintain that new, stronger standard or to reach it. I've mentioned already our Risk Management Plan program and STAR program. And again, we'll talk about those in just a little bit more detail. But as for a call to action for this board, the US EPA is currently finalizing a revised particulate matter national ambient air quality standard. They took comment back in March on changing the current annual standard from 12 micrograms per cubic meter to somewhere between 9 or 10. But oddly enough, they took comment on 8 and 11. We've heard that a decision on that standard will be coming later this month. So stay tuned. We'll let you know when that is finalized and what it means for our community. So to start our conversation today, here at the district, we operate a network of 5 sites around the city where we monitor for those criteria pollutants. We don't monitor for lead here in Louisville anymore. We don't have any lead sources, and with the phasing out of lead in gasoline, we were able to demonstrate that our lead levels are below a necessary detection limit. It's still an issue, particularly with respect to soil exposures, home exposures, and also from lead-lined water lines. We're the ones who send out the air quality alerts. Our ambient air monitoring supports the air quality index. It's a national way of communicating air pollution impacts on a daily basis. You may remember we've had a lot of air quality alerts coming out this summer because of the Canadian wildfire smoke, both for ozone and particulate matter. And in fact, you may see some Canadian wildfire smoke out there this morning. But when we issue an air quality alert, we work with our partners in the Indiana Department of Environmental Management, because our area is served by 4 other monitors, 2 in Clark and Floyd County, and also in Bullitt and Oldham counties, to issue those air quality alerts. And then we notify a slew of partners, National Weather Service, Trimark. We send out alerts via social media, email, and we also alert the media. We're also among the few in the nation who are conducting near real-time air toxics monitoring. In 2017, we purchased an auto GC. This is a field deployable auto GC, and installed it at our Algonquin Parkway air monitoring site. That is in the heart of Rubbertown. During the West Louisville air toxic study, it was the site of maximum impact. And so we are able to see those emissions at their source. We're also doing the same technology in use at our Cannons Lane in-core multi-pollutant site. This monitoring is actually required by the 2015 Ozone National Ambient Air Quality Standard to look at volatile organic compounds and how they may be photochemically reactive. Fact of the matter is, those same photochemically reactive compounds are the same air toxics that we're monitoring in Algonquin Parkway in Rubbertown. And so we have a really unique opportunity to see near source and more urban source impacts in the same airshed. I want to mention here, because we're going to talk in a few minutes about the sort of monitors that are used during an emergency response, about low-cost air sensors. Our air monitoring networks are focused on long-term, systematic air monitoring processes that provides legally defensible data and gives us an opportunity to really understand what's happening in our airshed and meet those national ambient air quality standards. Sensors are a low-cost recent development where we've seen outstanding development on particulate matter sensors. You may be familiar with Purple Air. They're used nationally. A lot of weather stations have them. We see them on US EPA's fire and smoke map being used here in Louisville. In fact, there's a community out east who put together their own particulate matter sensor network. It's very exciting work. Ozone sensor technology is good and getting better, but sensor technology for volatile organic compounds, to compare to our regulatory monitors, still has a bit of a way to go. So that work is underway. We've worked with US EPA on developing some of these technologies as part of their work in Rubbertown. And we have also secured funding for an air sensor lending library. That will be coming later this fall. We'll have sensors that we can partner with community groups and JCPS to do projects to better understand air quality at a local level. We've also installed a sensor co-location shelter at Cannons Lane air monitoring site so folks can bring their own equipment and partner it with a regulatory monitor to see how it performs. For particulate matter monitors, we're also able to help develop a specialized correction factor to make that sensor read more like our monitor. So that's fun work. We do permit pollution here in Louisville. We permit about 600 sources of air pollution emissions here in Louisville. They range from very large sources, which are regulated under US EPA's Title V operating program. We're delegated that here in Louisville, and so we write the permits for those, as well as for sources that could be as big as Title V, but take a limit. All told, that's a little over 200 in some of our 600 sources. That permit is a written authorization to build, install, modify, remove, operate, handle equipment and materials that emit or control air pollution. With that in mind, we do not permit hazardous materials releases. Permits that we the permits that we issue include guidelines to be sure that we make progress towards those national ambient air quality standards, and importantly include the compliance measures for that source to demonstrate that they are operating the equipment effectively, that the equipment is achieving the control efficiencies as expected and continue to do so during the life of that equipment, and that the source is following all rules and regulations. A specialized part of that work is our risk management plan program. We are one of 9 authorities in the nation who have retained delegation of the risk management plan program. This came out of the 1990 amendments to the Clean Air Act, and it requires companies that have a threshold amount of flammable or extremely hazardous chemicals to do some advanced planning. It's very comprehensive planning. It's quite a detailed regulation and quite a detailed review they have to do and plan they have to repair. APCD administers this program. We receive the reports. We review those reports to be sure that they've hit all of the required elements. And then we maintain those reports here under Department of Homeland Security restrictions. Because we're not first responders, we pay for half of the salary of an emergency management staff member who is specially hazmat trained to conduct inspections in these facilities and to also be our boots on the ground during hazardous material responses. We use program fees, especially assessed for the RMP program, to fund that position, as well as our own staff's position and work. The compliance group also receives excess emission reports. These are reports that are required anytime there's a release to the air that may violate a permit issued by the district or the district's rules and regulations. These releases may also be separately reportable as a hazardous material release under different authorities. We also look at not just releases, but also daily compliance for adherence to the Strategic Toxic Air Reduction Program. And there we're focused on long-term cancer and chronic non-cancer risks. We may take acute risks, such as those that may be posed by a hazardous materials incident, into account when we set a civil penalty. If you have a release that would hit that acute level, it can be used to adjust a civil penalty upwards. Here in Louisville, the guiding authority for hazardous materials releases is our Louisville Metro Hazardous Materials Ordinance. Under it, MSD serves as the administering agency. They get to herd all the cats. They also have a program to develop and approve hazardous materials use and spill prevention control plans. There are release, reporting, and notice requirements. And importantly, the release here is guided by something called a reportable quantity. Those are set out in federal law, and there are a few that are specially laid out in the hazardous materials ordinance itself. Anytime there is a release outside of a building, inside of a building, to the air, to the sewer system, or to the soil, facilities here in Louisville are required to report that through 911, and that activates the hazardous materials response process. The ordinance does provide for enforcement, including civil penalties, cost recovery for responding agencies, and it has an appeals and overseer board. The health department is also authorized here to issue citations, ordering cleanup and remediation. Now, these next two plans are a little bit inside baseball. If you took a look at them, you'll see that they are not very easily understood by the common reader. They're very jargony, but we have an amazing, well-trained, professional hazardous materials responding group here in Louisville. They understand what's in this plan. For APCD, RMP, or Risk Management Plan Program, is specially listed in here, as well as there are about 20 companies here in Louisville that are subject to the Risk Management Plan Program, and they're part of a group of 500 companies that are required to report where they store hazardous and flammable materials on their sites. Emergency Planning Commission, and also to the local fire departments under the Emergency Planning Community Right to Know Act, SARA Title II. For APCD, this plan calls for us to advise and respond to any air quality issues. We have specialized facility knowledge because of our permitting processes, and also because of that risk management plan program, and also because of our air monitoring. We have specialized air quality knowledge. In the hazard mitigation plan, and this was just recently updated, APCD's role here is to support and participate in the plan preparation. This covers everything from natural hazards all the way through public health emergencies, was recently added following our experience with COVID. APCD's role in this plan is to issue air quality alerts if there is, for example, a nearby wildfire. We're also called out here for our strategic toxic air reduction program, because that too helps us avoid hazards in that hazardous materials release category. We also advise and respond here as well. This really gets to the nuts and bolts of how emergency response happens here in Louisville. We use an incident command model here. When that hazardous materials incident occurs and that call to either 911 or the National Response Center is made, the fire department's role, those incident commanders, we'll talk about them in a moment, they are responsible at that point for assessing the scene and deciding, it's my risk to my responders, to the facility employees, to the public, and the environment. Using that assessment, you then call in other partners as needed. Urban fire departments, I'm going to go through these real quickly. I want to point out two things. Most importantly, all the people I'm going to talk to you about are specially trained hazardous material technicians. They have specialized equipment to monitor the air during these events, and in MSD's case, they can also monitor the water. Emergency management, the same. Public health and wellness, the same. All these folks are on scene during those emergency events, and they have a suite of equipment at their disposal, very specialized equipment for them to be able to understand what is the risk going on at the time. And this is somewhat different than what we're looking at in our air monitoring. Again, that long-term systematic impact, those annual cancer, chronic, non-cancer impacts. Here, they're really looking for exposure that's imminently dangerous to life and health. Or if it's an ongoing event, whether or not it triggers a permissible exposure limit that would impact their workers. Here in Louisville, again, we are well served by an incredible group of extraordinary first responders. To give you a couple of examples, in March of 2022, a company named Allnex, kind of over near the airport, had a release of styrene to the sewer system. It's not their first, unfortunately. In the area where this facility is located, the sewers are untrapped. So when there is a discharge to the sewer system, it is an exposure with the nearby community. In this case, the Ashland station responded. APCD was on our way, but when they declared the hazardous materials incident, we drew back, waiting for the fire department to call us if needed. In this case, they called MSD, Public Health and Wellness, and EMA. If needed, we do have specialized knowledge about this facility. It's not a risk management plan program facility, but we know where their equipment is located, where their raw materials are stored, what raw materials they have on site, and what their release looks like under some pretty sophisticated air dispersion modeling under our strategic toxic air reduction program. So if this had been a larger event, we may have been able to provide information about where a plume was most likely to go. We have a monitor over on Durrett Lane where we could also monitor evacuation routes if needed. Evacuation routes are not specified here in Louisville because in each incident, you have to determine where do you want people to go and how are you going to keep them safe and not drive them into the hazard. So we work with folks in order to provide that assistance as well.
Let's take about 3 minutes, 5 minutes, and wrap up so we have time for questions.
Perfect. Thank you very much.
Instructional. Thank you.
So with Applegate Lane, this is entirely different for everybody. This isn't a source that reports its flammable or hazardous materials to the local emergency planning commission or to the local fire departments under the Emergency Planning Community Right to Know Act. It's not something APCD permits. We have no specialized knowledge here other than air quality information. So in this instance, this is actually one where the incident commander called in the Kentucky Division for Waste Management and Emergency Response. They also called in the US EPA. APCD was brought in to share our specialized air quality knowledge and assist if necessary in the development of an air monitoring plan if a burn were to take place. We also have some responsibilities here for ambient dust. That's just a general nuisance rule that we have. And also, as with any facility, we implement the National Emission Standard for hazardous air pollutants, and that includes asbestos. That, unfortunately, is something in demolition of all structures we have to account for. In emergency demolitions, there are ways to do that. The Rhodia site is even a different situation. This is a remediation site, was used as a chemical manufacturing facility for decades, and like many communities, left a brownfield behind. The Kentucky Division for Waste Management has required the site to be fully characterized. There have been multiple rounds of site sampling to determine contaminants in the soil and in the groundwater. With respect to that, in order to remediate the site, they will be removing tons and tons of soil. To do that, the Kentucky Division of Waste Management approves a plan that evaluates the contaminants here, how they will meet the state remediation standards. It includes a site exposure assessment for workers and also post remediation, and that's all routes of potential exposure, including ingestion. It includes site-specific exposure monitoring for workers, and they use equipment very similar to what's used in emergency response. And there they're looking at that worker to see if they meet OSHA standards. Or if they encounter something unexpected, does it violate a permissible exposure limit or a PEL under OSHA, or potentially one of those imminently dangerous to life and health standards? Finally, the project does include fence line monitoring. Both APCD and the health department have offered some review of the proposed plan there. And then finally, our jurisdiction is in the ambient air. And so our rules that cover things like dust and odor are going to apply in this case as well. There is a fair amount of stinky things. Naphthalene, which you may be familiar with as the smell of mothballs. Xylene, which is that magic marker smell you remember from grade school. And then there's some methylbenzene, and these have fairly low odor thresholds. So
Ms.
the
Hamilton,
contractor,
about 1 minute to go.
thank you. The contractor has provisions in place to use some mitigation strategies to tamp down that odor as well as dust during their remediation process. And with that, I am done.
Oh my goodness. Thank you. I sound like a mean referee, and I didn't mean to, but because what you're sharing hits some of our board members who actually had contacts and friends who were in the affected area. So that's why I wanted to make sure that you highlighted that, and let me go ahead at this point before I ask a question, to turn to the board and ask for questions and ask for Arlena's help in letting me know, or if you all will speak up, that you have a question.
Good morning, Marta Sanchez. I'm I'm a certified healthcare interpreter. I'm also the Hispanic Program and Outreach Specialist over at Gilda's Club. It's a cancer support community. And I was also a CERT member, which is the Community Emergency Response Team, back a couple of years in Texas. And we went through something having to do with a train derailment. And there was, I don't know, chemicals. And we had to go through all the things that you were mentioning. One of the things that I have a question about is cancer. Do you keep a record of cancer-related matters when it comes to air pollution and things of that nature?
So what we have actually is monitoring information. And that information goes back to 1956 with the first Clean Air Act. For those of you who've been around a while, we're all familiar with the 1970 Clean Air Act, but it actually started out with a request from Congress to figure out what was in the air we are breathing. Louisville participated in that 1956 study. I have that study on the table in my office. It's one of my lodestars in terms of the work that we do here.
Mm-hmm.
So I can see how much people have been exposed to over their life. There have been other air toxic focused studies, including the West Louisville air toxic study in 2000 through 2006. We're running an auto GC that will detect those air toxics, including carcinogens, in our Algonquin Parkway air monitoring site. And then hopefully by the end of the month, we're going to hear whether or not we have been successful in a grant from US EPA working with the West Jefferson County Community Task Force and the University of Louisville Environment Institute to again do a full assessment for exposure to carcinogens. We also look at those non-carcinogenic impacts. Our strategic toxic air reduction program requires us to evaluate emissions, and then if they don't meet the environmental acceptability goals of the program, require reductions from companies here in Louisville.
Thank you.
Sanchez, does that cover what you were looking for?
One more. The Right to Know Act. How does the civilian act on that, given the matter that took place over at Applegate Lane? You know, nobody knew about this, and so how do we keep vigilant to that?
That's a really great question. You know, with the Emergency Planning Community Right to Know Act, it's directed at facilities that store threshold amounts. Someone hoarding chemicals falls outside of the typical requirements. In this case, I think we've all learned a lesson to be vigilant. And I believe, as Mayor Greenberg has readily explained, you know, but for the concern of citizens raising it as a bigger issue, it might have gone undetected for a while longer. So definitely see something, say something in unexpected places is really good advice.
Would that be considered what happened at Applegate, something similar to when somebody has a meth lab or
Yes,
something?
it could be. Absolutely. That's very analogous to a meth lab. And, you know, there, again, it's see something, say something. If there's someone in your community who is doing, you know, illegal activities, it usually gets brought up to the police. Hopefully, again, we've all learned to be, you know, more cautious about chemicals in our environment, including those that our neighbors may be using.
Thank you. Other questions?
Hi.
Eccles.
Yes, thank you. As someone who is particularly susceptible to the outside air quality, like myself, as I'm sure we can all kind of hear and see through my nose and voice today, I know that we've talked a little bit about this in the past, and we do have a lot of industry here, and you've even touched on it a lot in your presentation with us as far as, you know, we have certain regulations or certain thresholds that companies have to be, you know, within for their emissions. Um, I think my question is, especially with Louisville, with us kind of like being in a dust bowl and the geography of our city, like some things are just you know, a little bit maybe harder control when it comes to the air quality. But I wonder if there are active strategies or policies that we have for kind of not just making sure that our, you know, emissions thresholds are within that EPA standard. Do we have any ways to clean our air or improve our air quality that are maybe like a policy or any kind of initiatives that like we as the board could support? Um, Technologies that you all are developing or things like that? I mean, you have a lot of engineers, so I'm hoping just personally that please tell me there's help, that there's something
There is.
we can do.
Absolutely. So thank you for recognizing the geography. That's one of the things that does challenge us here in Louisville. You know, meteorology and geography, it does put us into a bowl. So, you know, for us, we do go beyond the federal programs here in Louisville under our rules. The START program is but one example. It's a really good example. It's helped us out because we've been able to reduce not just air toxics and the potential exposure there, but also because ozone, which is not a direct pollutant, it is the combination of nitrogen oxides and volatile organic compounds in the ambient air during summer months. It's knocked down a whole lot of volatile organic compounds. For us, this PM standard will likely have some reductions, we hope, when Mill Creek shuts down Unit 1 in 2024 and later Unit 2. It's going to drive down a lot of nitrogen oxides that will help us achieve ozone attainment, as well as particulate matter reductions. We don't regulate mobile vehicles. So mobile sources provide a whole lot of pollution here in Louisville. As we've driven down those facility emissions, we've seen an uptick in vehicle emissions. We're a logistics hub. So places and policies where we can have smarter transportation, including some of those engineers to use some of those sensors to better align our traffic corridors. Changing over technology to electric vehicles will have a major impact. Some of our options here in Louisville really are supported by trees, by reducing heat island impacts. And there's just a whole lot of interrelatedness in terms of our work, that of the work of public health and wellness, our partners in the Office of Sustainability, the Environment Institute, and the Green Heart Project. So we're at a tipping point where pulling us together so that our work not only is effective in its own way, in its own silo, but that we work together to really leverage and amplify all of those initiatives. When we drive down pollution because we conserve or we use solar, convert cars to electric, add trees to reduce heat island impacts, these things all help all the other work that we do. And in fact, we're looking at developing a multi-pollutant strategy at this point. For several years, we've worked with US EPA, and the National Ambient Air Quality Standards are set out in a pollutant by pollutant basis. So for us, with respect to a new PM standard, we'll see benefits because we'll reduce nitrogen oxides when we reduce coal combustion. We'll see changes in ozone NACs, and then we'll reduce volatile organic compounds, which will further reduce air toxics. We'd like to pull all those things together into a more comprehensive focus and use that to really drive not just unexpected or kind of bonus secondary benefits, but to really leverage those secondary benefits in our own work. And we're always looking to partner with our Metro peers and others to leverage the work to amplify its impact. So I hope that helped answer your question.
Yeah, I think one of the benefits that the district has are the collaborative partnerships. While your responsibilities statutorily, regulatorily are very different, excuse me, by the collaborative partnerships that you have, it serves to improve the quality and to identify areas for improvement. And let me just say this, or ask this: were there any takeaways that the board noted or the district noted that emanated from the Applegate Lane and other, more recent events? Anything that was unusual, or plotting down this very well-defined standard best practices that are currently in place? Hello?
I think from an APCD perspective, it's one thing to have a plan on paper. It's another thing to have to activate that plan. And so
Clearly,
there will always be lessons learned from the activation of the plan. And I really look forward to getting the Applegate Lane site cleaned up, and then sitting down as a group and talking about what went right, what went well, and what could go better. But I'll also say that here in Louisville, from a day-to-day work standpoint, there's a disconnect to some extent between information availability for the public. At APCD, we make our excess emission reports, which we receive an initial notification within an hour or two of an event. It is really just a heads up. Within 2 weeks, we have a detailed response from the facility about what happened and why it happened, and we put that up on our website. Public doesn't need an open records to access it. They can go ahead and just simply find it at their convenience. And then they can follow up with us if they have concerns about what our next actions may be. But not every release is reportable to APCD, so not every event has an excess emission report. And it can be difficult, given all the different entities involved in an emergency response, for the public to know where they should go to find more information. So I'm very happy to say that we've met with our partners at EMA to talk more about how we provide that information more easily for the public.
Thank you. Other questions?
Chair Margulis,
Yes.
this is Arlena. Dr. Smith put in the chat information about the meeting that will be held on tomorrow. Note the public meeting being held tomorrow, and he has a link to that pertaining to Applegate. I just wanted to mention that.
I do have a question, and that's about the intersection between your work and city policy, zoning, regulatory activity. You know, one thing, for example, you know, I've paid attention to the number of cities across the country that are reducing the number of drive-through restaurants as a way of reducing vehicle emissions, fighting air pollution, that sort of thing. And here in Louisville, every time I turn around, there's a new drive-through that seems to be opening or expanding. And I just wonder about the intersection between your efforts and council policy, zoning decisions around issues like drive-through restaurants.
So with respect to drive-through restaurants, we don't have that much interplay at this point. I will say that some of the options that EPA has laid out, if the particulate matter national ambient air quality standard were to be reduced as low as 8 micrograms per cubic meter, it would involve APCD regulating more closely, not the drive-throughs from restaurants, but the actual grills, the particulate matter that they produce. That's different than our current regulations. Our rules and regulations are passed here in a public way. Anything that we propose, we put out publicly for an extended, usually an advance notice of proposed rulemaking. We then take comment on that. We develop a rule from that information, put that out for a public comment period, and then our board has to adopt it through a public hearing. So, you know, in terms of helping policy development, we have really good mobile source modeling that we can do. So if there are places where you want to pursue a policy like that, we can assist with some modeling of those vehicle emissions and provide that data. But you've really hit one of the biggest nails on the head, and that's zoning. And the Louisville Metro Office of Planning and Development is currently going through a land development code equity review. And the third phase in particular, APCD is partnered in that part of the conversation in light of where we put facilities in our community. Once the zoning is decided, APCD's role is to make sure that that facility meets our very stringent emission standards and follows our rules. That said, the zoning process isn't the same for everyone. There's a large swath of enterprise zoning throughout West Louisville down to South Louisville, kind of travels that outer band along the river and also down the I-65 corridor. And if you get a chance, you should look at the land development code and see what can be placed by right, meaning you don't get to go to BOZA and talk to BOZA about whether you want that in your backyard. but the number and types of things that can be placed in enterprise zoning 200 feet from a residence. It includes things like concrete batch plants, among other things. And nowhere else in Louisville Metro would it be allowed without having to go and talk to the people about the quality and fabric of your neighborhood. So we look forward to that third phase work, and certainly that's a place where we hope you may join us in really talking about how we put things in the land to promote better health and better quality of life.
Thank you. Next question. Well, hearing none, this was highly interesting, timely, succinct, and I think gives us all, first of all, better awareness, as well as the need to find ways and organizations. One of the values of this board are the networks that each member of the board has to get information out to the organizations that they are a part of, and to spread the word, so to speak. Because this is so timely, I do ask the board to do that. But this has been excellent, and we're honored to that you took time to share with us, because I think that it falls squarely in the center of what this board is charged with doing, and greatly influences better health in the community. So thank you very much. And as always, we will send out the presentation. It'll be among the post-meeting materials that you receive. Thank you, Ms. Hamilton, and the very best to you.
Thank you very much. And again, we're represented by amazing hazardous materials responders here, including our own public health and wellness. So thank you all for your board's work and for the invitation today.
Okay, thanks. Okay, board. Let's any comments, or are there any items that you wish the board to consider as it relates to the presentation today, or policies that you think need advocacy, et cetera?
Madam Chair, probably considering local policy with respect to the Right to Know Act.
Yes.
I can't tell you exactly, but I think that we should consider policy when it comes to, people who, I guess, warehouse chemicals and things of that nature. It would be something to brainstorm, and I'm not familiar if the.
Well, I would ask the staff to take a look at what the relevant partner agencies and how that process works, to get back to the board, because we don't emanate policy. We, excuse me, bring it to light of the organizations that, that are directly involved with it. So if there is something in particular, what I would do is to forward, and you can copy me, and talk with Deputy Mayor George or her designee for this issue to see if there's anything else the board might be helpful with. Does that make sense?
Yes, thank you.
Okay, let's, hearing none
If I
then.
may,
Yes,
sorry. I just wanted to say to Martha, please feel free to connect with me directly. I know one of the things we certainly want to do is make information more accessible, more meaningful. So, you know, it's one thing to share it. We are often data rich, information poor. So it's a matter of what do you do with that information. And I would say in the instance of Applegate, the important thing to remember is that he was harboring chemicals illegally. He had illegally obtained a lot of the chemicals. So our ability to track them would have been very limited. With that being said, I'm open to ideas, maybe gaps that you see as it relates to individuals storing chemicals in residential areas. So if there's a model or something that you think we should be doing, please let me know.
thank you.
Yes, ma'am, thank you.
All right. With that, Deputy Mayor George, the mayor's office update, please, and the incredibly interesting pilot that relates to food security.
Okay, so two things pretty quickly. The first one is Deputy Mayor James and I just came back from a fentanyl summit that Mayor Adams held in New York in response to the child care facility that was trafficking fentanyl that resulted in the death of a child. I will say my takeaways from the summit would be the fact that we in Louisville are really supported by a very robust public health department that is doing tremendous work. So of all the innovative practices that were shared, I can say the vast majority are things that we're already doing here. And so we can feel good about that. On the downside, I will say I'm not coming back feeling hopeful about our ability to fully execute harm reduction in addition to impacting the supply chain unless we devote more resources to the work. Quite frankly, what big cities are seeing is an influx of incredibly lethal fentanyl. So in New York, 7 out of 10 fentanyl pills have a lethal dose. And so the ever increase of lethal fentanyl, in addition to xylazine and or tranq, is really a concern. And so I think, again, we should all feel good about the work that public health is doing, emergency response is doing, but clearly we need to scale up efforts if we're to make any gains given what we're up against. Second update I wanted to share was on what Chair referred to around food accessibility. One piece that's important to know is that the administration is focused on better streamlining food accessibility within Metro. Right now, we know we have several people doing really important work, but it's kind of spread out amongst agencies. And so we're going to be putting focus on ensuring that we have a streamlined process as it relates to food accessibility that includes supporting growers, all the way up to, you know, how distribution and how folks access and experience food in community. The second piece of that is we are working with Kroger to, you know, we started wanting to learn more about mobile markets. Obviously, there are several limitations with our existing strategy on mobile markets. And so that has shifted to looking at what we can do to scale up distribution and food delivery, while yes, of course, focusing on the long-term goal, which is community grocery. So those are the updates I have, and I'm happy to take any questions.
Questions for the deputy mayor. a lot going on that will have meaningful impact on all areas of the city and county. Okay, and I believe Deputy Mayor shared the proposal on the mobile market. Okay, moving on, the chair does not have any additional updates to share at this particular time. And so therefore, what I'd like to do is call on our interim director, and I think it may be Dr. Spindle, because of a medical appointment that the interim director had. So, Dr. Spindle?
It looks as if he is not on the line. He may be disconnected because he is out of the country.
Oh, that's right. He's in Guatemala. What he wanted to convey, I believe, on behalf of Connie Mendel, was that for nonprofit organizations out there, they can apply for free at-home COVID tests. Let's see. Arlena, can you help me out here?
I'm happy to jump in. This is Taylor.
Yes, Taylor.
Hey, good morning, all. Yes, the team at the department continues to do a lot of great work, lots of important updates in the director's report. If there's anything there you'd like to learn more about or you've got any questions, please reach out. But for action items this morning, would love your help in helping disseminate information about the free COVID tests. There are tests that are available to the community and residents, and then specifically for nonprofits, and that information's in the report. And then the other action item, just wanted to remind you all and help you disseminate the message through your networks as well, to get your COVID booster and your flu shot. And that's all from us.
Yes, as I had indicated to some, I have done so a few days ago, both flu and COVID, and ask everyone else to protect themselves in the right way, especially in your work in the community, etc. Any questions?
Quick question for Taylor. Is there like anything that we're sharing in particular? Like, is there like a flyer or like something for like our social media platforms, or is it just like we're just spreading the word? Like, is there an
And
official?
also in Spanish and the other languages?
Sure. So we don't have a particular flyer. We have been promoting information throughout our weekly newsletter and our social media channels. So feel free to forward those on or reshare them in whatever format makes sense. And then Kathy put a link in the chat to our COVID-19 Resource Center that remains on the website.
Excellent. Excellent. Okay. Well, then let's go to action items, and or actually, yeah, the Medicaid Coverage Coalition. But before that, I think what I'd like to do with everyone's approval is to have Family Health Centers brief report, because I believe you have something that may need board action.
Yes, thanks, Heidi. We have 4 board members, Family Health Center board members up for reappointment, and we have an additional board member who has gone through the interview process and been approved by the Family Health Center Board. I just need approval from the Louisville Metro Board of Health to appoint them to Family Health Center's board.
Let me add a bit to Dr. Irwin's request to the board. I would tell you that I've read all the resumes, and the good news in this is they've had from the private sector someone who had health systems operation experience, near 40 years of running or being responsible for hospital healthcare systems, and also managed Medicaid plans in the private sector. So a very good add to the board, and an important skill being brought. So any questions for Dr. Irwin? Any questions on his request? The chair would entertain a motion to approve the appointments to family health centers as required through the code.
So moved.
Is there a second?
A second.
Is there discussion? All in favor? Can you just say or tell me how many? Let me go the other way if I could. Are there any objections? Hearing none, the board approved the action requested from the family health centers in terms of board appointments, confirmations, etc. Okay, so approved. And anything else, Dr. Irwin?
Yes, I have a brief announcement. Family Health Centers received notice last week that it had been granted a $350,000 HRSA grant to start a school-based clinic, and we'll be doing that at Iroquois High School. We plan to have a nurse practitioner, mental health professional, and related staff at the Iroquois High School.
Thank you. Thank you so much for doing this. It'll be interesting to hear about progress. Anything else? Ms. Shoemaker? Hello?
Yes, can you hear me?
Okay, yes, go.
Our next meeting is scheduled for October 9th at 4 o'clock. We will be discussing the Medicaid renewals. We're starting to see some positive movement in terms of Medicaid renewals around the state. We are seeing fewer terminations than we were seeing at the start of the unwinding. So we will be discussing that, as well as open enrollment for qualified health plans.
Very good. Good news. Any questions for Ms. Shoemaker? All right. Immunization committee.
Yes, new developments from the immunization committee. We are so fortunate and happy to inform the board and the chair that we will have two very qualified and excited new co-chairs for the immunization advocacy committee. Dr. Ruth Carrico, who I believe several members of the board are already familiar with or acquainted with, and Dr. Anna Huang Schrader. They will be co-chairing the Immunization Advocacy Committee as we are getting into a pretty heavy immunization season as as Heidi has already mentioned and other people have already mentioned on this call, the strong recommendation from the committee is to get your flu shot for this flu season. And for anyone over the age of 60 and any women in their third trimester of pregnancy, we are also strongly advocating for getting the new RSV vaccine, or at the very least, having a conversation with primary healthcare providers about the benefits of that vaccine, as we've seen increased rates of RSV last year for sure, this time, and other just respiratory viruses. This is the time of the year for that. And as someone with respiratory issues and small children, I encourage anyone in the community who can to get these vaccines. So those are our updates, as well as the Immunization Advocacy Committee is currently in works with creating a proposal for promoting provider education. One of the available RSV vaccines is has a different mechanism and is slightly different for administration. So any community providers that may need some additional education or information about that, the advocacy committee is trying to develop that, and we have a proposal in the works for that. If anybody needs any additional information or has any question specifically, community providers or anybody that will be administering vaccines in the coming months, please feel free to reach out to myself or Patricia, Dr. Bautista Cervera, and we will be happy to get you in contact with and get you any materials that we have available regarding specifically those vaccines.
Superb. Very good advocacy on the part of this committee. Thank you. And send words back to them to keep it up. Rock star performance. All right. Any other advisory board members, any other committees, anyone else? I know that K&A has their focus on incentives to create a stronger nursing inventory to cover the need for healthcare workers. K&A has been outstanding in their efforts. Any other groups that wish to report out or inform or have an announcement? I'm running a little long today, but this has been excellent, and I, at this point too, want to say to the board that your engagement this meeting is has led to better discussions and meaningful discussions in terms of areas that need focus. Is there any new business to come before the board? Hearing none, and hopefully I don't mess this up. I believe our next meeting is November 1st. Boy, is that hard to believe. At 8 a.m. It will be in person at this point, but we have all sorts of wobblers, so stay tuned. And clearly there'll be virtual options. Anything else, guys? Okay. Is there a motion to adjourn? Well, let me say this a different way. If there are no objections, thank you for sharing extra minutes for this meeting and for the work you do. And remember, getting everyone immunized. Take good care. Stay and be well, and see you next month. This meeting stands adjourned.
Thank you, everyone.
Thanks. Bye.